Hi, everybody. This is the Dr. Debunk Weekly Podcast Show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is a subject near and dear to my heart, and that is about hormone replacement therapies. Specifically today about thyroid hormone. And this is a big deal in America today because low thyroid is epidemic in America today. Now, not thyroid disease, but thyroid deficiency. So today I'm going to go over why it's so screwed up in medicine and in America, why so many Americans are deficient, and what can be done about it. So I've been heavily replacing hormones in patients for 15 years. To give you a little background here, most people don't realize that there's two distinct medical treatment protocols for hormones to give patients prescription-based hormone therapies like thyroid and testosterone, estrogen, progesterone, growth hormone, but very few people take that because of its cost. But anyway, thyroid hormone, as a little history, is the oldest prescription hormone that we replace. It goes back to 1910. It's some really fascinating history about it. But what happened was we really changed how we gave thyroid hormone in the 1970s and early 80s when I became a doctor. And I'll get to that in a minute. But for now, think of thyroid hormone as far as its function as being the main hormone that controls energy, your perception of energy, both mentally and physically, and it's the most important conductor of fat metabolism. I mean, it really is the most important hormone regarding body weight, whether you can mobilize fat to lose weight or to store fat. I mean, many things affect fat mobilization, but without optimum levels of thyroid, you can't really effectively turn on the machinery to burn fat even with dieting. And without a doubt, the number one connection to weight in America is thyroid hormone. Thyroid deficiency is the main doctor connection. Now, it's not the only factor or even the main factor of the excessive weight gain in America today. That's just our nutty American lifestyle. But the metabolic connection, it's all about thyroid. So understanding thyroid hormone, simply put, think of it as a switch. Thyroid turns on every organ in your body. So thyroid turns on your brain to think, your hair to grow, your eyes to see, your heart to beat, your muscles to have energy. It's really like the switch that would turn on the electricity to power up all the machines in a factory. Thyroid plays this huge role in the efficiency of organ system function. In other words, how efficient do your organs work? Essentially thyroid turns on the energy generators in the human body. If the body ran on electricity, then thyroid would be the switch that connects generators to all of your body to power it up. Current medical science recognizes that optimum thyroid levels have a significant effect on your ability to waste food calories and therefore optimize body weight. Now, that's really a weight loss concept that I teach, but this is something that started about 12 or 13 years ago. And it really has made us understand the significance of the excessive weight gain in America and being tired. I mean, the reason Americans are fat and tired isn't because you're fat. I mean, people say, well, I'm tired because I'm fat. No, you're tired because you're low in thyroid. Anyway, thyroid hormone is the most complex hormone that physicians manipulate. And the main reason for that is we've been using thyroid for over 100 years. We've been studying it since 1910. And because of that, two distinct theories have evolved over the last 100 years. Now, let's talk about the primary model or the primary theory, how it came about. Well, the primary theory didn't really start till about 1975 to 80. That's when blood tests came online. We didn't have blood tests before 1975-ish. And so we use the secondary model, which I'll talk about in a minute, which is the better model. But the primary model basically says that blood testing determines the diagnosis, that your blood level, if it's normal, means your body level is normal, that the blood level equaled the body level. And your symptoms as a patient are basically ignored, and then the treatment is with the weak form of thyroid. And it doesn't work very well, honestly. And so the primary belief also of physicians, the primary treatment model, is that disease and all levels of deficiency are the same. There's no difference. Success of treatment is based on getting your blood level where your doctor likes it, and it doesn't matter how you feel or what your symptoms are. And the bottom line is this system, this model of treatment fails to treat the first 4 levels of deficiency. More about that in a minute. Now, the secondary model of thyroid treatment that's come about because this primary model failed by about 1985 to 90, when I was first a doctor, we started to realize the failure of this because the patient's symptoms didn't match the treatment outcomes. And that the only thing this primary model treated was disease. If you had low thyroid disease, which is extreme deficiency, then this model would help. What doctors do today helps. But it didn't treat any other levels of deficiency. So the secondary model will treat all levels of deficiency and disease. And it was successful, honestly, 60 years before blood testing was invented. I mean, if you think about it, we didn't have blood testings till, say, 1975-ish, and yet in 1910 we started to give thyroid. Well, how did we do it? I mean, if we didn't have blood testing, well, we would treat symptoms. Now, there's some problems with only treating symptoms alone, but it worked fine overall. But the problem is blood testing became common, and it's easier to do. And if you do the secondary model, then you have to analyze patients' symptoms, and we don't want to do that. Because in the secondary model of treatment, which is a correct form, patient signs and symptoms are the primary tool to diagnose, and then treatment is equally done by blood levels and symptoms, which I'll talk about more in a minute. So, in the secondary model, the good model, all 3 forms of thyroid can be used. I mean, there's basically weak, medium, and strong thyroid, and depending on what you need is what you get. Most people take the medium level of thyroid. And the goal of this treatment is to optimize the level of thyroid in your tissues, your body level, but not looking at a normal level of thyroid in your blood. That's the goal of the primary model. The primary model says your blood is everything, but the blood is not relevant. It's your body level. Your symptoms come from your body, your tissue levels, not the blood level. Now, blood testing is important, even for the secondary model, but its main use is to ensure you don't get too much thyroid. And you modify treatment in complicated thyroid cases, because sometimes it's complex. So here's the $1 million question. Why do 90% of doctors today still use this Stone Age model, which is what I call it, Stone Age medicine, that came about in 1985, and it's no different. Doctors are still doing this same treatment protocol from 1985. Why do doctors do that since the secondary model works so much better? There's 5 main reasons. Medicine studies and treats disease, not deficiency. Therefore, deficiency is outside the scope of medicine. And I won't explain it more than that, but it's absolutely true. We believe deficiency and disease are the same, but it's not. And then the second reason is blood tests cannot diagnose deficiencies of any hormone, unless the deficiency is extremely low. Reason number 3, we don't use the effective model. Doctors, unfortunately, are like everybody else. We believe in factoids. Factoid, in case you don't know, is just a saying people say over and over and over and over and over and over again until people accept it as a fact. But the evolution of thyroid treatment over the last 100 years produced a medical factoid, which is the blood level of a hormone equals the tissue level. It's fiction. It's not real. That's not true. There is no science in the history of medicine that's ever been done that shows that the blood level of a hormone correlates with the tissue level. And I'll explain that in depth in a minute. And the 4th reason the secondary model isn't used more is because primary care doctors don't like to mess with hormones because the outcomes don't match the blood tests. Therefore, patients are sent to endocrinologists, the hormone specialists, who only treat disease, not deficiency. See, when your blood test says that your thyroid level is fine, but the patient complains of perfect low thyroid symptoms, it's a conundrum for the doctor. We don't know what to do with that because the patient is giving you 4 out of the 4 top low thyroid symptoms that really can't be explained by anything else, but the blood test is normal. So the doctor doesn't know what to do with that. So you get shipped off to an endocrinologist who really doesn't care about what you say. And if the blood test says you're normal, then you're normal. If the blood test says you're a green Martian, you're a green Martian. If the blood test says you're from Jupiter, then you're from Jupiter. Specialists really don't care what you say most of the time. It's just about what the tests say. And then finally, the 5th reason we're not doing the correct model is doctors have forgotten that patients' signs and symptoms, what you feel as a patient regarding hormone deficiencies, what you feel comes from your tissue levels, not your blood level. The blood doesn't make you feel anything. The blood is just the highway that carries the hormone from your thyroid gland to all the cells of your body, to all the tissues of your body. You feel tired, have low body temperature, you're mentally cloudy, you're constipated, your hair's falling out. Those are low thyroid symptoms. You feel that because that's what's in your tissues. And doctors have seemed to have forgotten about that. So, as I've said many times in other podcasts, what do we really do as doctors? Early detection of disease is what we do. Diagnosing of disease and the treatment of disease. This has nothing to do with deficiencies. So, let me explain that since I've said it a number of times. What do I mean by deficiencies? Well, it relates to what level of hormone is in your tissues. Well, we have 5 identifiable states. In other words, if you ask patients precisely how they feel and their feelings of their body regarding hormones, you can have 7 different answers. So you can have a 52-year-old man or woman describe to you that their energy levels are great, that they have the same energy as when they were 22 and now they're 52. And they can use other descriptive words that make us know that, well, your thyroid level must be optimal. And so that's an optimal hormone level of thyroid. And then people at 52 could say, well, I have good energy. I'm a little less than 22, but not much. Well, we'd call that normal hormone levels. But then there's 5 different ways people talk about symptoms that are consistent with minimal, mild, moderate, severe, and extreme deficiency of thyroid. So you can have minimum symptoms of low thyroid, mild symptoms, moderate, severe, or extreme deficiency of thyroid, which is equal to thyroid disease, low thyroid disease, or what we call hypothyroidism. Okay, so the dilemma is, which I'll talk about in a minute, blood tests are normal from optimal all the way down to severe. So, I want to back up a second and talk about that medical factoid thing, because it's important. So the factoid, again, it's a belief that's just based on people saying something over and over and over again until it's accepted as fact. And so the belief that the blood level of a hormone equals the tissue level of a hormone came from kind of bad science in the 1970s, but also immature science. We believed something about how thyroid and all hormones go from the blood to the tissues. We believed in something called, simple diffusion and not active transport. We used to think that if you had 100 thyroid in the blood, that over time 50 would get into the tissues and 50 would stay in the blood. It'd come to a balance. That's not true. We know that's not true. It's actively transported. Hormones are pumped into the cells, which means you can have a different level inside the blood and a different level inside the cells. And so that, the science has changed, and yet the treatment hasn't. So I can say this confidently at 100% certainty. There is no medical science in the history of medicine that has shown that the blood level of a hormone equals the tissue level. There has never been a laboratory or clinical trial that have shown this to be true. And what I mean is, they have never done a blood level of a hormone, like say blood level of thyroid, and at the same time a tissue level and a symptom analysis. Do all three at the same time, then you could say what is true, and they've never done that. So we believed that the blood equaled the tissue came about by inference. We inferred it from the work done from 1970 to 1990. The entire primary treatment model, which is a failure for low thyroid diagnosis and treatment, rests on the belief that blood equals a tissue level. If you take that away, it's a done deal. The primary model is dopey. And so, as I mentioned, to understand this more clearly, we talk about 5 levels of deficiency that exist in hormone replacement therapy: minimal, mild, moderate, severe, and extreme. And so to understand them, minimal symptoms of thyroid deficiency are barely noticeable symptoms. You have a minimal drop in energy, a teeny bit of weight gain, and your exercise energy is a little low. When you're mildly deficient in thyroid, you have noticeable changes over the last few years in energy, weight, exercise energy, sleep, mood. You think it's because you're getting older. Except the problem now, low thyroid's epidemic for women in their 30s, so it's hard to really pin it on age. Then a moderate thyroid deficiency is obvious that your energy is wrong. Your energy is low every afternoon, like clockwork. I mean, you have to push to get through the day. Your weight is too much. I mean, you've gained 20 pounds over 1 or 2 years. Dieting doesn't work very well. It just doesn't seem to make you lose weight. You sleep more, but you're still tired in the afternoon. You'll nap in the afternoon when you can get away with it. And these are the main symptoms of moderate low thyroid. And then severe low thyroid is you wake up tired. That's the biggest thing people complain of. Is like, Doc, what is wrong with me? I wake up tired 5 days a week. I wake up, have some coffee, I'm good for an hour, and then I'm tired. Severe lower thyroid people nap almost every afternoon. It's hard to work sometimes. You're gaining weight out of control. Hair is thinning. Depression is noticeable. You sleep 10 hours a day and wake up tired. And you can't exercise. If you exercise, it wipes you out. And it's like you feel like you turned 80 years old. I mean, most people that have the mental ability to push themselves to exercise when they're severely low in thyroid will immediately after they exercise go home and sleep. I mean, they have to sleep. And then extreme low thyroid, which is diseased hypothyroidism. Your energy's so low you can't work, thinking is difficult, you feel like you're retarded, you sleep all the time, you feel cold because thyroid turns on the heaters and you can't turn them on. Your body temperature is low if you check it, 96, 97. You're significantly overweight, depressed all the time, hair thinning, and you can even have slow heartbeat. So those are the 5 levels of deficiency. And so the discrepancy then between deficiency and blood testing makes it clear why thyroid deficiency is not being diagnosed or treated in America today. Classical medical treatment fails to recognize anything other than kind of severe or extreme thyroid deficiency, and then we call it disease. Compounding the problem is the fact that thyroid deficiency is epidemic in America today. It's an epidemic problem. Non-diseased people in, I can safely say, the millions have a certain degree of thyroid deficiency. And so the million-dollar question is, why? Well, because of 6 reasons. Thyroid deficiency for non-diseased people is caused by, see if this fits your life, see if this is relevant to you. Too many days of stress, too many days of depression, eat too many carbs, don't exercise enough, don't sleep enough, chronic inflammation, and then being exposed, actually there's 7, to pollution of modern society. I mean, does that sound familiar to anybody listening? Well, these 7 lifestyle patterns are common for all of us. I mean, they've gotten worse with each generation over the last 40 years. Therefore, it's causing an epidemic of low thyroid starting in the 30s. I mean, today, like I said, women by the mid-30s are epidemically low in thyroid, well over 60-70% of women, and men, it hits them in the mid-40s, which is why we see today 60% of Americans or more are 40 pounds over ideal body weight and complain of being complain of being tired, and are addicted to caffeine. I mean, think about that one. Why are Americans epidemically addicted to caffeine? I mean, when I grew up, nobody was on caffeine. Nobody. Nobody drank coffee, really. There was no soda abuse. There was no energy drinks at all. They didn't exist. Americans have noticeable levels of thyroid deficiency, which makes us fat and tired. And it's just an obvious reality. But it's not being diagnosed because of the blood test problem. And so then what is the solution to this problem? Well, the solution is to supplement with the minimum amount of thyroid hormone necessary to achieve optimal tissue levels in your body, which is possible more than ever. Why? Glad you asked. Because the medical research of the last 10 years is so proving that thyroid deficiency is different than thyroid disease. So therefore, optimizing your hormones is what you need to have done for you, and it will significantly change your life. Now, you wouldn't have to take thyroid if you could live a life that would promote optimal production of thyroid naturally by your own thyroid gland. But for most people, unless you win a lottery and move to the Caribbean, because, if you win a lottery, you figure, well, I'll go to the Caribbean. And you'll live there for 2 years to get super healthy. And you'll have a coach, a cook, a trainer, a shrink, give money to the poor, laugh all day, eat organic food, work out 3 times a day, and frolic around in the waves. Now, if you could do that, then you wouldn't need to supplement with hormones. But what's the odds that you're going to be able to do that? No, you're going to have to keep living your life and having those 7 things: stress, sleep, too many carbs, not enough exercise, pollution, and the other 2, which have popped out of my head. But if you can't correct those things, which most of us can't, then you're going to keep being deficient in thyroid hormone. So, all of that to get to this point. How do you correctly supplement with thyroid hormone? Well, I'm going to tell you if I can get to the right place. First, you take the correct form of thyroid, which depends on your particular signs and symptoms. Remember, I said there's weak, medium, and strong. Secondly, you take a little extra thyroid in the beginning so you can eradicate the deficiency state more quickly. And then third, when you start to feel optimal energy levels for your age and your weight responds normally, you taper down to get the correct amount of days and dosages to be optimal. And then we use blood tests at the correct time to ensure that you have proper levels in your tissues, which now can be done with this model. See, you can make the blood level of a hormone equal the tissue level, but only when you supplement with the hormone, and you can't do it with the classical model, as I've mentioned. Now, this model works better than any form of hormone replacement in the history of medicine, bar none. And I can confidently tell you that because for the last 15 years and thousands of patients that I've treated have been doing this, and they get the results in the end. I mean, this is what I tell patients. They come into my office and I tell them, give me 4 to 6 weeks to fix your thyroid levels. And if it doesn't fix your energy, help you with weight and the other symptoms of low thyroid, fire me. If I don't fix you in 4 to 6 weeks, fire me. Nobody ever fires me because a medical student could treat your thyroid deficiency if we taught them correctly. But we're not teaching them correctly because we're doing Stone Age medicine that was from 1985, and we're still doing the same thing, even though we have all this science, and there's a lot now, to show that it doesn't work. So, that is kind of a big picture introduction on how to do thyroid replacement therapy. What I just said is true for all hormone replacement therapies. And so the only thing I have to say left, really, is if you're fat and tired, and you have no diseases, and you're not significantly sleep deprived, the only thing it can be is low thyroid. There really are no other causes. Which leads to the final thing of, how do you get treated? How do you find a doctor that uses the secondary model that works so well, where the doctor listens to your symptoms and treats your signs and symptoms, and then uses blood tests to help give you the right amount? How do you do that? You got to find a doctor that has realized the failure of classical medical diagnosis and treatment of hormone replacements. So the tips I can give you is, you really probably need to look at family practitioners. They do this more than anyone. Family practitioners that talk about doing bioidentical hormones. You can read about that. You got to find somebody in your area that says they'll do any kind of natural treatments, hormone replacement therapies, bioidentical hormones. Those are the keywords you look for when you search on the internet. Now, many doctors, well, most doctors don't understand the hormone therapies the way I just explained it to you, but they'll treat you correctly, they'll follow your symptoms, and then they'll do the blood testing to make sure you're not taking too much. It's just all over the map. Slowly but surely, we are winning this battle. More and more primary care doctors are moving towards the secondary model, which is to treat patients' signs and symptoms and not use blood tests to diagnose. So let me do a quick summary and we'll be done. Optimum thyroid levels are essential for optimal energy, weight management, mental clarity, basically metabolic function. Number 2, simply because of the evolution of modern medicine, hormone deficiency syndromes fall outside the scope of classical medicine. We're treating disease, not deficiency. Number 3, because of this, an epidemic of untreated thyroid is running rampant in our country. Thyroid deficiency is rampant. Not disease, but deficiency. Number 4, correctly diagnosing and treating hormone deficiency syndromes like low thyroid is possible, and the results speak for themselves. Classical treatment doesn't get results. The secondary model I just explained does. Number 5, after a few months of treatment, patients have optimal energy and weight, well, the possibility of optimal weight control, and in the end, perfect blood tests to confirm it. Because the secondary model, in the end, will give you great blood tests. I mean, you have to do the right ones. But, and then number 6, treating hormone deficiencies has really come to maturity because of the last 100 years of trial and error. And that's what it's been, trial and error. Now, I've been doing this particular model for 15 years, and well over 1,000 patients get their lives back. And that's pretty much it. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. Thanks for listening.